Hello, could you
Hi,
please introduce yourself?
my name is Christy Cox, and I'm a physical therapist for Valor Health.
Okay, and why did you choose the career of physical therapy?
Well, when I first started out, I had an aunt that had to have an above the knee amputation because she had a cancerous tumor, and so I watched her go through therapy as a young child and then moved to Oklahoma and was going to go into nursing, couldn't take the blood, so I uh, volunteered and did some tech work, and I saw how stroke patients would begin to walk. It was very enlightening and encouraging to see that. So
That's great. And how long did it take you to achieve a degree in physical therapy?
it took me 5 years. It's a bachelor. When I first started, it was a bachelor's program, and in 2000 it went to a master's program, and now in 2020 it'll be a doctorate program. But OU, where I graduated from, is already a doctorate program.
Okay, so if you went back, would you still choose to go the physical therapy route?
Yes and no. I really enjoy what I do. I enjoy the people. I enjoy seeing them help. But I think that I may be expanding and would maybe be a physician's assistant. I still like to do patient care and work with patients, but I don't know if I would want to do it that long, to go to school that long now.
Now that it's a doctorate program, are you familiar with kinesiology majors majoring in kinesiology for their bachelor's and then going on to be a physical therapist?
Yes, even in my class we had 44 in my class of therapy, and a lot of them had kinesiology degrees. Now they encourage people to get either a, a chemistry degree or a kinesiology degree because it really highlights what physical therapy does. We do movement, and it's very important. It's a big aspect of physical therapy.
Okay. How long have you been in the physical therapy field?
For 24 years.
Wow. And have what aspects of the job do you enjoy?
Well, I enjoy interacting with people and hearing their life stories. It's very encouraging to know what people go through and how they've made a sacrifice and accomplished an injury. That's very enlightening to me. So,
Where else have you worked besides here at Valor?
um, quite a few places. I worked at when I first got out of school, I worked at a hospital in Chickasha, and then I worked at St. Anthony's, and then I moved to outpatient and went to a place that did only workman's comp, and then I went back to St. Anthony's, and they were purchased. My clinic was purchased by McBride, and which was all workman's comp, and then I went to Health South for a year, and then I came here.
All right. And what is the typical pay scale for physical therapists?
Well, when I first got out of school in 1986, I made $10.25 an hour.
Wow.
Now, probably a new grad would make between 50 and 60,000. And if you owned your own practice, you could easily make into the six figures.
Okay. And as you continue on, does the pay scale continue to rise, or are you on the higher end of the pay scale with your
I'm
position here?
probably on the higher end of my pay scale, yes.
Okay. Um, and if you had any advice for current kinesiology students, what would it be?
To, to stay focused, and that there is an end to all your hard work, and it's really life rewarding, and it's very good to continue. I think that you will be rewarded, hopefully, as you go. It's not the money that you're interested, but it's also the people, because you have to be a people person to be a physical therapist.
All right. Great. Thank you, Christy.
Mm-hmm.